between sexual transmission and perinatal transmission in any country of Africa. Thank you very much.
As you are no doubt aware, the idea of this teleconference was conceptualized by the Executive Director of AHEAD, the ever-dynamic Mrs. Elvira Williams, who realized the need to bring together women from all over the world to talk about issues of concern. My involvement is a testimony of the fruitful cooperation that exists between AHEAD and the Gambia, and I would like to seize this opportunity to express our deep appreciation to AHEAD for doing a wonderful job in the Gambia during the past 2 years. My involvement also is an indication of the high priority given to women's health issues by the competent authorities in the Gambia. This teleconference, the very first of its kind, is an excellent opportunity to bring together women to discuss issues that have impact on not only us women folk, but also on our children and on future generations.
This is the first time that women from Africa, the Caribbean, and the U.S. have held a live dialogue about health issues that affect their daily lives. This dialogue is being broadcast to 44 African countries, 11 Caribbean countries, and 35 European countries, as well as being viewed by audiences around the United States. Today, for the first time, a panel of experts, members of our studio audience, and women from Macon, Georgia, here in the U.S., will share experiences and information with women from the cities of Accra, Ghana, Windhoek, Namibia, Dar es Salaam, Tanzania, Yaoundé, Cameroon, and Kampala, Uganda. This teleconference is a project of AHEAD, an acronym for Adventures in Health, Education, and Agricultural Development. AHEAD is a not-for-profit organization established to improve the quality of life in developing countries through comprehensive self-help programs. There are literally dozens of health issues of concern to women around the world. Today we will explore the status of and solutions to 4 such issues: maternal health, AIDS and other sexually transmitted diseases, refugee health, and personal and collective empowerment. Here to share their expertise in these areas are 4 women with a demonstrated commitment to providing and improving the well-being of women throughout the world. Dr. Smith, how do you define the term maternal health?
Well, Iraka, you have just identified some of the traditional issues that I think that we're concerned about for women all over the world, those health issues that are related to pregnancy care and pregnancy outcomes. I would like to expand the concept to women's health overall and to respectfully borrow the title of an editorial written by Dr. Helen Rodriguez-Trias in the Journal of the American Public Health Association a couple of years ago. She used the phrase women's health, women's lives, and women's rights. I like to think of maternal health and maternal and child health in the larger context of women's health. I think this acknowledges that there are socioeconomic and cultural determinants of maternal health issues. We're born female, in that we are born, as you say, with that distinct difference, ovaries, a uterus, fallopian tubes, but we become women. We become sisters, we become grandmothers, we become mothers, and we become providers of care in our families. And I think that that broadens how we can look at maternal health issues.
And now we're going to hear a message for support from Dr. Susan Blumenthal. Dr. Blumenthal is Deputy Assistant Secretary for the Department of Health and Human Services and the Assistant Surgeon General of the Public Health Service.
Good morning. It is my pleasure to be here on behalf of the Department of Health and Human Services to congratulate AHEAD and all of the participants here around the globe for their work and their efforts to advance the health of women worldwide. In the United States, 4 years ago, our country began to witness the greatest focus on women's health in the history of the nation. During that year, we exposed the inequities in both the conduct of research and in access to healthcare services that had put the health of American women at risk. Women had been excluded from most of the research studies conducted in this issue. There was little funding for women's health concerns and access to healthcare services. Women often are underdiagnosed or undertreated for healthcare conditions. For minority women, this is all the more devastating. Minority women, while the incidence for certain diseases like breast cancer is lower, the mortality rates are higher. And minority women are suffering disproportionately from sexually transmitted diseases, from AIDS, from the effects of violence, from other chronic diseases. The Department of Health and Human Services is committed to rectifying these inequities through the Public Health Service Office on Women's Health and the Office on Minority Health. We are working together to advance the health of women in this country, but also worldwide, working with our International Health Office. We are here to work with you to find ways to increase not only research, but access to those needed preventive and healthcare services. You know, one of the most pressing issues facing women is chronic disease in this century. We've extended the lifespan for women, but longer life doesn't mean better life for women worldwide, because women suffer greater disability and poorer health outcomes from disease than do men. So one of our major areas of concentration must be to promote healthy behavior in young women, starting with the girl child and the adolescent. And that means finding ways to encourage women to have healthful diets, to exercise, to refrain from cigarette smoking and substance abuse, and to practice safe sex. But this must be coupled with ensuring that women have an equal place in education, economic equity, opportunities in the workplace. Because without those changes in our societies globally, we will not be able to advance the health of women. So let us work in partnership around the world. And we also have a new group that will be helping us, the World Health Organization's Global Commission on Women's Health, which the U.S. serves on, and which many countries around the world are participants. This Global Commission is going to focus in on women's health across the lifespan, and to take an advocacy role in doing this. Let's join together in partnership around the world, consumers, healthcare professionals, and policymakers. If we work together, I know we will be able to advance the health of women in each country around the world. Thank you.
Thank you, Dr. Blumenthal, for your statement of support on behalf of the Department of Health and Human Services and the Office of the Surgeon General. Dr. Blumenthal made reference to the scourge of AIDS that is going across our entire global community. The plague of the 20th century, acquired immune deficiency syndrome, has brought pain and death to individuals and families and has ravished the populations of entire continents. After a history that includes myths and lies about its place of origin, descriptions of it as a natural mutation or a bioengineered weapon, and debates as to whether or not the world health community is responding equitably to the needs of all people to be educated and protected, what we are ultimately left with is a fatal, debilitating disease that today knows no cure. Dr. Oluyemisi Adesanya, what is the current status of the AIDS epidemic? Is it as bad as it has been? Have there been advances? Can you share with us an update?
In reviewing the existing literature, there's good news about AIDS in that in certain high-risk groups, the rapid increase that was originally seen has slowed down, and this was the original high-risk groups described in the 80s, such as IV drug abusers and homosexuals. The unfortunate story about HIV is that it seems to be spreading amongst people that were once considered to be low risk. In June 1993, according to the CDC report, 315,000 cases of AIDS were reported, of which 62% of the patients have died. There's increasing prevalence, especially in the rural areas. They have the highest rate of increase in new cases, and also amongst low-income population, amongst ethnic minority groups, and amongst the heterosexual population. These were once groups that were considered to be at low risk. And also, the spread is in areas where healthcare is not as adequate as in urban areas, such as in rural counties. Now, across the world, for example, in Tanzania, approximately 800,000, that's probably about more than twice the figure reported in the US, were described in Tanzania. And of this, an equal percentage of people have been afflicted with it. By the year 2000, AIDS-related deaths would be one of the leading causes of adult mortality in sub-Saharan African countries.
You've indicated that there is the highest percentage of increase in categories that were considered to be low risk. What does this mean about our actual knowledge about the causes of AIDS and of its transmission?
There are several things that's a very loaded question. I think that what we're seeing now is a spread in heterosexual AIDS transmission, apart from homosexual AIDS transmission. The once considered high-risk groups, like the IV drug abusers, are still part of this equation, but the heterosexual transmission is now higher. And you're seeing, especially in developing countries, the newer cases of AIDS are occurring amongst reproductive age women, and also children are being affected more. I think people are aware about how this disease is transmitted. Through reading the literature, perceive that even though they're aware of it, very few people make any effort to really change their sexual practices. For instance, in a recent study where they evaluated IV drug abusers in New York and gave them intervention, the subjects evaluated would change their habit with respects to intravenous drug use. However, their sexual practices were unchanged. It was almost as if they didn't pay attention to it. So I think that, yes, the message is out there that it's sexually transmitted, but we need to hammer it and home it down in people that you need to change high-risk sexual practices. And if you can't, then try to use something that will prevent transmission, such as condoms.
Thank you, Dr. Adesanya. We're going to now take a question from a member of our studio audience. Please state your name and any affiliation you may have.
My name is Dr. Melissa Clark. I'm an emergency medicine physician at Howard University. I participated as a physician volunteer in the AHEAD programs that take place in rural Tanzania. We conducted HIV and AIDS seminars for the village healthcare workers. The participants were both men and women village healthcare workers. And I was struck regarding the change in behavior and the high prevalence of HIV that Dr. Adesanya mentioned, that one possible factor is the role of empowerment of women, which I believe we're going to get to later, in terms of being able to practice safe sex and use condoms in social situations where they may not be empowered to make those decisions. And I just wanted to see if any of the panelists could comment on the role of empowerment in the process of the spread of HIV. Thank you.
I will not subtract from the later discussion that will come about women's empowerment, but that's a very, very good issue. Considering, for instance, that in African countries, the women that are high risk for this are actually sometimes married women who are married to men who have other partners. And they're married to well-educated men or higher social level men. I think that by empowering them, some of this can start to change. They do not have to accept some of the things the society has says is their lot, and they better sit quietly and accept it. I think that would help in that aspect.
This is United States Senator Carol Mosley Braun. I am honored to participate in your town meeting, and I commend your activities to encourage communication and dialogue among people of color around the world. I am especially pleased that this teleconference focuses on an issue that is near and dear to me, women's health. After many years of relegating women's health to the back burner, the United States has taken great strides to improve education, prevention, research, and treatment efforts targeted to women's needs. Women are beginning to be adequately represented in clinical trials so that we will know how new research discoveries and technological innovation will apply to women. Just last year, we increased funding for diseases that affect women, like breast and cervical cancer and osteoporosis. I have asked for greater focus on lupus and sickle cell disease so that we may learn why these illnesses primarily afflict minority women and find a cure.
I salute AHEAD, the organizers of this conference, for sharing a collective position of the women, that we talk not of first world and third world, of north and south, but of one caring, sharing world.
Freedom!